This is Reb Kean. He is a physician associate in the United Kingdom. The UK just recently, I think in April, is that correct? Changed from physician assistant to physician associate, which is something that there's a lot of kind of energy in the United States to follow their lead and change as well. I'm a physician assistant in the US, and I think we kind of get lost in the bubble and we forget that there is PAs all over the world that do the same thing that we do here in the States. And the goal of this webcast is to just kind of reach out to Reb and have him explain to us what physician associates do in the UK, how they're used, how they're perceived. So, I'd like if you could just kind of tell us a little bit about your background and kind of how you got into becoming a physician associate.
Yeah, and first of all, I guess I should say that we followed your lead really in terms of the physician associate. There are about 250 PAs in the UK, and we were aware, I was sitting on the board of directors for our professional body, UCAPA, at the time. We were aware that there were steps in America, there certainly was a momentum in the US for PAs to change their name from assistant to associates. The Department of Health in the UK suggested that it might be a good idea for us to change our name because there are other professional groups that use the term physician assistant in the UK. There are two other professional groups, and because we were modelled on your profession, they wanted to kind of differentiate ourselves between us and them. So we kind of took your lead, really.
Okay.
So how did I become a PA? So by background, I'm a registered nurse. In fact, I'm still a registered nurse for healthcare professionals in the UK and social care professionals. We have a system of national registration or statutory regulation. I think in the US you have a state license to practice.
Correct.
Is
Yeah.
right?
Correct.
For example, how it works for health professionals here, and this isn't the case for PAs at the moment, but as a registered nurse, I'm registered with the Nursing and Midwifery Council, and it's a statutory body that we register with, and that's what we're aiming for in the UK for PAs. At the moment, we don't have that. We have a voluntary body, which is a kind of a step towards statutory regulation. So I was a registered nurse, and I've been a registered nurse since 1993, which gives my age away a little. I kind of left clinical nursing, and I have a master's degree in medical law, so I was teaching medical law, wanted to go back to do clinical work, and had read about the PA programme. As I said, there are very few of us in the UK. There are 250 around about PAs, a population of 60 million.
Wow.
It's
Is that number increasing, or is there more programs starting?
Yeah, at one point there were 5 PA programs in the UK, and for various different reasons, 3 of the programs closed down. And so there was a program in London at St George's and one in Scotland. It's worth pointing out that in the United Kingdom there are 4 separate countries, and the NHS works differently in each of those separate countries, even though we're all under the United Kingdom. So it's a little bit like the United States in some ways. Each country is separate and run separately. A new course has just been announced. It is one of the previous courses. It's University of Birmingham. It's one of our biggest and most important universities. PAs will be trained at the medical school.
Okay. So you mentioned that you were a nurse before going back to PA school. Does the UK have nurse practitioners, or does that field not exist over there?
Yeah, it does, and it's very well established as well. It wasn't taken of the United States. So maybe one of the problems with nurse practitioners is there's no kind of accredited course that makes you a nurse practitioner. So nurses now in the UK are graduates. So they will have done a 3 or 4 year programme, maybe differently to the United States, but it's all funded by the government, and in fact nurses in the UK are paid to train, so they get a bursary. I forgot the question. What did you say?
So, in the States, a nurse practitioner and a physician assistant, we function the same way. It's the same job. It's a different education, but we both practice the same way.
Yeah, there are tens and tens of thousands of nurse practitioners in the UK, so they do work at a higher level than a general registered nurse. But there's no kind of accredited course that says once you've done this course, you are now different from a regular nurse. Nurse practitioners, we also use the term clinical nurse specialist sometimes as well. I don't think you use that term in the States, but they can prescribe and they will be trained usually in the medical model, but in a small narrow field. So rather than being generalists like PAs, maybe a respiratory nurse will know lots and lots of stuff about lung problems, but very little about any of the general medical area.
Okay, so they basically all specialize and.
Right, yeah.
Okay, all right. So if you guys have such a small group right now, I know you said you're growing, and but with just having the 250 plus PAs, how are you guys perceived by physicians, and how are you perceived in the community and by the patients?
Pretty much, it's the distribution of PAs in the UK is geographically based around the universities that run the programme. So in the West Midlands, where I live, which is kind of the centre of England, there are lots of the NHS trusts employ physician assistants or physician associates, and there's lots in London, and there's lots in certain parts of Scotland too. In Wales, for example, there are no PAs at all in Wales, and there are some PAs that work in private practice. I know a couple of PAs that work in independent practice, and that's going to be different to how things are in the US, where you physician assistants, as I understand it, always work as a kind of dependent professional. Is that correct?
Correct, yeah. So a PA, we practice under the license of a physician. We can see patients independently, but we have to have a physician available, whether they're physically in the hospital or if they're, reachable by phone and within so many miles of where we're practicing. They just have to be available for consult. Is that similar to how yours is set up?
Yeah, no, not so much really. I think kind of historically in the NHS, nursing is very, very different from medicine. It's seen sometimes as kind of a competitive professional body really, and that perhaps is true of lots of the other healthcare professions too. So there's no kind of precedent for this kind of dependent practitioner status. The university where I did my PA training, the tutors were American PAs, and they often talked about the dependent practitioner kind of model, but I'm not really sure how well that fits into practice in the UK, really, where if you're a professional, you're autonomous, and you're expected to be autonomous. So I think perhaps the philosophy is that maybe PAs are supposed to work under the supervision of a medical practitioner. I'm not sure that is always the case, really, and I do know of a couple of PAs who work independently.
Okay. And you work in psychiatry, is that correct? Is that?
Yeah. I work in the second biggest city in the UK, and I work in the homeless population, so all my patients are both homeless and mentally ill. And of course we don't use DSM-4, we use ICD-10, or DSM-5 I think it moved to.
Okay.
So we use ICD-10, so that's really, really different. I often read about things like borderline personality disorder or antisocial personality disorder. We don't use either of those terms in psychiatry.
Okay. Yeah, we're kind of transitioning to the ICD-10. It's not in the States yet, but it's coming. We're still in ICD-9 format.
Okay.
Yeah.
Right, okay.
What can you kind of just give us an overview on how your health system works? I mean, it's completely different than the way our healthcare is set up.
Yeah, so we do have some private provision in the UK, although it's not popular. One of the big organisations, for example, is called Bupa, and it's a non-profit organisation. That's the biggest organisation. So I guess it's kind of a cooperative in some ways. So any profit it makes will be paid back into patient care. There's no shareholders, but that's really tiny. Everybody, all British citizens, are entitled to free NHS care, which is funded out of general taxation. We have access to emergency care and long-term care, primary care and secondary care. The situation, how it works is very well, very good actually. I've read quite a bit about Obamacare, and how a lot of people in America don't agree with it, but approval ratings for the NHS in the UK are enormous. It's our kind of one of the things that we're most proud of, and certainly I don't mind contributing my taxes to people who are less fortunate than me.
Yeah, Obamacare is pretty polarizing here, so.
Yeah.
That's a separate webcast, separate video that we won't dive into that.
Okay.
Yeah. So how is your guys' license set up? Do you take a national exam after you're done with schooling, or?
We do. We have a curriculum framework for physician assistants or straight physician associates. So we all follow kind of basically the same curriculum. It's a 2-year postgraduate program. So, for example, my first degree was in nursing, and then we take a kind of state final national exam at the end of the 2 years. And then once again, following from your lead, we are going to take our exams once every 6 years. Is it 5 years for you guys?
We can take the test a year early, but we have to recertify every 6 years. And probably I think starting next year, they're changing that to a 10-year cycle. So we'll push our national. It's called the PANRE. It's the recertification exam, and we'll have to take that every 10 years instead of every 6.
Okay, that's something I'll take back to you, Kappa, actually, because of course we take a lot of your lead, really. We kind of follow what happens in the US, because PAs are so well established there. So I don't think you, Kappa, is aware of that. We're making lots of plans for this year.
We have to do continuing medical education to maintain our license, and so they've made some changes to our CME credits. And in exchange for that, instead of taking the PANCE every 6 years, it's going to be every 10.
Okay, yeah. We have to do something similar called CPD, Continuing Professional Development.
Okay.
So, for example, I think it's 40 hours a year that we have to kind of accredited courses or programs that we have to attend.
Okay.
As the exam.
All right. So the whole physician assistant, the physician associate that's something that we're having. There's a lot of energy in that, changing our name, because it's kind of similar to what you guys deal with. Is the term assistant is used in a lot of other areas in medicine, and how did you guys change that? What kind of steps did you take?
Essentially, it really came down to, after the Department of Health had suggested that it might be a good idea as steps towards national regulation, statutory regulation, we had a vote on it, our kind of governing professional body, I guess, and it was overwhelming. I think it was 88% in support of changing our name to physician associate. The preliminary stages of discussion, I didn't think it would actually pass, and I was sitting on the board of directors at that point. Because there were lots of reasons for not changing. For example, we might lose our links with the USPAs, and you have to remember that the AAPA gave us a really generous amount of money to set up UCAPA initially. So we kind of see you guys as our kind of a parent body, maybe, or parent profession.
Okay.
And also, you guys have done lots of research about PAs, and if we suddenly called ourselves something different, it would maybe lose that link as well. You know, people were searching for research about how good PAs were in primary care. Physician assistants and physician associates stand up two different things, don't they, really? So, however, we get to keep the PA term. So that's a good thing. I mean, I voted for it, and I argued really strongly for it as well. So I was really pleased that it passed. Okay.
Do you still serve on the board of directors for UCAPA? Are you still?
No, I don't. My term ended on the 1st of July, and I didn't stand for re-election again, just simply because I'm involved in a medical education charity. I don't really have the time. And it's really time consuming as well, actually. So we had a national conference that I organised for all PAs in the UK in April, which is when we had the vote announced for PAs for our name change. And after that, I was pretty much done.
Yeah.
And kind of was quite happy for someone else to take over.
Okay. So where do you see your profession going or growing in the UK? What's next for you guys?
Yeah, I mean, I guess for 99%, I mean, there are a handful of American PAs that still work in the UK, but for 99% of PAs that are working now, we're all newly qualified, so we've all qualified in the last 2 or 3 years. And if I think back about how I was 2 or 3 years after I qualified as a nurse, I still didn't know very much. It's a huge learning curve the first few years. So I guess a lot will change as PAs kind of mature as professionals, as individuals, as well as a profession. I think speaking for my trust in particular, they started off, my NHS trust, sorry, it's a trust is kind of a health organisation. Speaking for my trust, they started off with a small pilot group of PAs, just a couple, and I spoke to the workforce director on Friday, and I know that we're going to recruit more, so we've gone from 2 to I think it's 9 of us now, and there's plans for more to be employed in 2013 and again in 2014. And I think that's pretty much the same. Whenever PAs have gone into a hospital or a local community trust, once they've kind of go over the first couple of years of settling down and people get used to PAs and what we can do and what we can't do, they often go on and employ more PAs. So I think the prospect will keep on growing. We have supported the government for PAs as well, and the Department of Health have been really, really positive about our role and what we can contribute. And to be honest with you, if the Department of Health, if we didn't have that Department of Health, we wouldn't stand a chance. But the NHS is really keen on us developing as a profession. So
that's nice. And you guys can prescribe, and can you work in surgery? Can you work in any aspect of medicine, or are you restricted there?
Yeah, we can't prescribe actually. I will be prescribing in my role because I'm still a registered nurse. So, but the majority, there are a couple of other PAs in the UK that are also registered nurses that also prescribe, but for the vast majority of PAs we can't prescribe.
Okay.
So that causes some people more problems than others. If I could have prescribed in my role, it wouldn't really impact very much in mental health because I have a consultant and there are other medics that I could get to prescribe things. But in other circumstances, like people that work in emergency medicine, for example, I imagine it is more of a problem for those than it would be if I couldn't prescribe. In terms of, yes, in Scotland, there's a real impetus for getting PAs involved in surgery, and we work in every area, paediatrics, the oncology, emergency medicine, family medicine. I think we call it GP. You call it family medicine. Yeah.
Okay. This is exciting. I think it's always interesting meeting people that do the same thing, but you're halfway around the world, and yet we practice the same way. When we started talking several months ago and got up to today when we're speaking in person, I've learned a lot. I think this has shared a lot of information that people in the U.S. will be excited about because, most people don't even think that, you're over in the UK doing the same thing we're doing here, fighting the same fight that we're fighting and, taking care of patients. And I appreciate that you took time with us to explain what you guys do over there. Is there anything else you want to share with us? Any other, aspects of your job or your career?
I said that there are a handful of Americans that are still over here from the original pilot groups that came over like 5 or 6 years ago. When I was on the board, we frequently used to get inquiries from American PAs about working in the UK. So that's something that is still it's possible. It's and there's still people are coming over for placements or for employment. So the Americans have grandfather rights in the UK, so they don't have to sit a new exam or anything like that. So
okay.
If people are interested, there are jobs here. The demand outstrips capacity here at the moment. So I don't know any PAs that don't have a job.
That's good. You need to try to get your exam pushed back to 10 years.
Yes. I have 3 years to go, so I'm a little anxious.
Yeah.
It creeps up.
You can turn that 3 years into 7, so.
Yeah, that'd be great.
Yeah. Well, this is Reb Kean in the UK, specializes in psychiatry, and we really appreciate you sharing the insight on what you guys do over there. It's exciting, and I hope that we could probably follow up again in a couple months, and kind of, I'm sure this will generate some interest, and there'll be more questions that people will be curious about what you guys do.
Okay. Well, thank you, Jeff. It's been good to have the opportunity to talk to you.
Yeah, thank you.
Thank you.